for joining us for the latest installment of COVID Conversations. We are here tonight for an honest conversation about the year of COVID we've all been living through and the rollout of the vaccine. I'm Katie Cristol, the Vice Chair of the Arlington County Board, and I am genuinely thrilled to be introducing our guests tonight, who are community leaders and members of our Complete Vaccination Committee. We have with us today Lara Mohammed, Saul Reyes, and Nancy White of the Arlington Free Clinic. So before we get really rocking with some conversation, I want to just take a quick minute and provide a little bit of an update on where Arlington is in the vaccine process. Here in the county, we are still working our way through the phase 1A and 1B priority groups. As you all probably know by now, that includes healthcare providers, it includes residents who are 65 years old and older, residents who are 16 to 64 years old and who have underlying medical conditions, and all of those are only those folks who have pre-registered. We'll be talking more about pre-registration and why it's so important later tonight. And we are also vaccinating frontline workers in phase 1B. So that includes all kinds of individuals in different forward-looking jobs who are out in the community. It's important that we vaccinate them as well to protect not only them, but all of those that they serve. And we've just moved into some of the latest subcategories, including sending scheduling notifications to public transit personnel, mail carriers, and others. Excitingly, over the past several weeks, our public health department has seen a significant increase in the vaccine doses they've received. And that means a significant increase in the number of doses they've administered. We've gone from 3,000 a week to 8,000 to now 9,000 doses a week. And we hope to sustain these higher levels and move more quickly into our 1C and eventually general population. So let's start by getting to know our guests this evening. I'm going to ask you each to tell me a little bit about yourselves. Let's start with you, Saul. What should we know about you?
Sure. My name is Saul Reyes. I have been living in Arlington for 25 years. I went to school here and graduated from Darnell High School. And I also work here in Arlington. I've worked here in various fields. In an organization I've always been involved with is BU-GATA Tenants Association and the Buckingham Youth Brigade, which is a program of BU-GATA. In fact, this group is the reason I developed the interest in community involvement at an early age, leading to now working in community and housing preservation advocacy in the low-income immigrant community here in Arlington. And it is a pleasure to be here joining us all here for this conversation.
Well, thank you. We're really excited to have you. Lara, what about you?
Hi, my name is Lara. I've been living in Arlington for 6 years in Douglas Park neighborhood. I am currently a sophomore at Washington Liberty High School. I'm very active in my community. I'm the outreach co-chair of Arlington Youth Philanthropy Initiative, a member of March for Our Lives Virginia's communication team. I lead a law advocacy group with leadership initiatives. I'm active in Rosie Riveters, and I was recently appointed to serve on the Girl Advisory Board for Girl Scouts Nation's Capital. At my school, I'm part of Black Student Union, Black Lives Matter Club, Student Ambassador, and Pennant Men Club, which is a student-led magazine.
And a member of the Arlington County Complete Vaccine Committee. So thank you so much for all of the ways that you show leadership in Arlington. And Nancy, welcome. Thank you so much for joining us as one of our CVC co-chairs. Would you like to introduce yourself?
Of course, and thank you, Katie. I'm Nancy White. I am president of Arlington Free Clinic, and I have been living in Arlington since 1988. I've raised my family here, and we live in the Line Village neighborhood in Arlington. I've been involved with Arlington Free Clinic as a volunteer for about 25 years and as the leader for about 5 years. And we provide free healthcare to low-income Arlington residents through the generosity of volunteers. And so I'm really happy to be here today, as also in my role as co-chair of the Complete Vaccine Committee, in order to get as many people vaccinated as possible. So thank you for pulling this group together tonight.
Well, we're really excited to have you all and to hear from you all. So let's start by just taking a minute to reflect. We're now as someone put it the other day, into year 2, which is a little bit scary, but having marked our 1-year anniversary of being shut down or limited or otherwise dealing with the impacts of COVID. What have been some of the biggest challenges you've faced, either personally or as a leader in different communities in Arlington County? And in what ways have you adapted? Would anyone like to jump in?
Sure. I guess I can get started with this. It has been a very long year. A challenge that we've met has been not being able to meet people in person. I know this has been very hard on everyone, and we can all relate to this. But I do feel proud of how many of us were quick to adapt and adopt the use of technology to keep connected. Related to work, we haven't been able to have in-person meetings with the community. We haven't been able to have get-togethers, community celebrations. For example, us at BU-GATA, we used to organize the Buckingham Community Festival, which we couldn't hold last year, or our holiday party in December. So those have been difficult. It's been very difficult not being able to have that, being able to meet in person. But we all had to find a way to stay connected. And I would like to say that I joined many who are excited to finally see some hope to returning to our pre-COVID lives and working together to accomplish this with a higher appreciation for the little things in life that we used to take for granted, but we know we value so much. I would also like to recognize that we have lost many lives to this pandemic, and my heart is with everyone who lost friends and family. And I know that's very difficult for us all, and we've all had to face many challenges. But I think that we are now seeing some hope.
Yeah. That's such an important thing to take a moment to remember and reflect on. It's been hard to do the types of rituals that allow us to manage our grief as well. Well, I'm sure the sense of not being able to gather has affected what school life is like, Lara. I mean, I don't know if you've had those experiences of missing milestones or the challenges of not being able to gather. What would you point to as some of the biggest challenges facing young people in Arlington, and any insights about what's been working or helping you overcome them?
Yeah, for me, it has been definitely school. I think it's been kind of hard to adjust to like online, and then now we're going back in person. So it's just been kind of hard and confusing because things change so fast. And I think like my generation is very like they use technology a lot, but I think still like moving all the meetings online and like all activities online, it still kind of gets a little bit overwhelming to have like a lot of meetings online. And then just to make sure like that you're safe all the time. And for me, one of the biggest things that's kind of like helped me cope with this is like my family. We kind of stay in our COVID bubble, and they all kind of live in Arlington. So that's been something that I always have looked forward to. And we're also now on spring break. So like the nice weather has also been kind of nice, and being able to go outside. And for me also like playing my violin and just doing the things that I like to.
I love that. Music and nature, right? Things that are scientifically proven to reduce our stress levels. That sounds great. Nancy, what do you all see with the Arlington Free Clinic community, especially?
Well, I think about this so much that everything we used to do has changed. We have had to find new ways to provide basic care, new ways to provide access to medications, new ways to vaccinate people, and ways to keep our volunteers and our staff and our patients safe, and at the same time being able to provide effective healthcare. And so we've done a lot of that on the sidewalk over the past year, and really meeting people where they are and helping people who had not used technology a lot learn how to do a telehealth visit. We went from thinking that was something we could never do with our patients because the technology barriers were so great, and the language and the literacy barriers. And Last year we did 2,300 telehealth visits in 9 months after the pandemic started, and it was challenging for our patients, but it also was challenging for a lot of our volunteer physicians, many of whom retired several years ago because they never wanted to see a computer again, and here they were setting up telehealth as well. But even as hard as it was for those of us at the clinic, it just paled in comparison to how hard life has been for our patients, that all of them lived on the edge even before the pandemic, and many of them were really put over the edge, and not just in terms of their health, although that's been a huge factor. The impact of the incidences of COVID in that community has been horrible, but also financially. Most of them lost their jobs in the first weeks of the pandemic, and many of them are still not working. And so it's, to see the resiliency that's come from this community and their ability to pull together, to learn how to use telehealth, to learn how to use the available resources, has really been heartwarming to see in a community. And they're survivors, and they're hard workers, and they've really come together to somehow make it through these really hard times.
Well, I think one of the things that all three of you talked about was the importance of community. And that's one of the big ideas behind the Complete Vaccination Committee, which, if those who are watching don't know, is a volunteer group that consists of Arlingtonians from every corner of the county who work to increase awareness of the COVID-19 vaccine. We ask our CVC members and our partner organizations to be essentially ambassadors, share information about the vaccine across their community, logistics about how to receive it, build confidence in the vaccine by talking about their why get the vaccine, what they know about its safety, and encouraging Arlingtonians to themselves participate in the vaccine the vaccine effort rather. So I would love to hear from you all. What motivated you to be part of the Complete Vaccination Committee specifically? Nancy, we should start with you.
Oh, sure, of course. Well, first of all, it's so critical, and I think from my perspective with Arlington Free Clinic, what we see when I look at our patient communities is barriers. They're language barriers, literacy barriers. Our patients don't necessarily have email addresses. They can't necessarily read in English. They don't go to websites to look for information in the same way that I do. Their abilities to access services is really limited and different. And they have learned a lot during this pandemic as well, but it's still so much harder than it is for me and for my peers to learn where to get a vaccine, how to sign up, how to get where you're supposed to be, how to learn about your second dose. All of those pieces that I can figure out are so hard. And so we have systems here at the clinic to be able to really shepherd people through that process. And we're used to calling people personally or texting them or using their own avenues for communication. And so I see firsthand how great those barriers are, and knew that my role with the Complete Vaccine Committee would provide a perspective that hopefully would help reach those individuals that were going to get left behind otherwise.
Laura, Saul, what's your why? Why did you get involved with the Complete Vaccination Committee?
Well, I think what Nancy just mentioned is very important, just connecting people to the right information and to the right resources. For example, I mentioned earlier my work with BU-GATA. I highly encourage people to reach out to organizations you work with. For example, us. We can refer you, we can provide you information of the resources, where to go for that information. You can visit the county website, the COVID website, call the hotline, or we can also help with registration.
So Laura, what inspired you to get involved with the committee?
So for me, I really feel like we're making an impact and really helping get the information out to a lot more people. I love how we focus our attention on different groups of people and take time to actually message the information towards those people. And I also really love how we all kind of use our connections to help spread the vaccine information. And by doing that, we make our community more safe. I was also previously on the Complete Count Committee for the census, and that kind of I was able to see firsthand how we were able to impact the community and really make a difference, which pushed me to join this committee. And I also really love that I'm able to kind of give a student perspective of the pandemic. So that's been really fun.
That's great. And to give a student perspective on our conversation tonight, which we especially appreciate. Okay, I think we've got Saul back. So I think you were sharing a little more about how people can reach out to organizations with which they may be involved if they're interested in learning more, or as Nancy was saying, they have barriers to accessing information about the vaccine or the vaccine itself.
And that is correct. Not certain at what point I was cut out with my internet connection, but yes, reach out to organizations, your trusted organizations that can provide you information or connect you to resources that can provide you the information, the correct information. And so to add to this, I would say is that I've seen the impact of COVID affecting our jobs, and as Lara mentioned, our schools, and also the overall community. And the reason why I got involved with the Complete Vaccination Committee is because I see the vaccine as a hope to get back to life. And I also know the importance of having accurate, factual information based on science. That is important. And the work of the Complete Vaccination Committee is key to get that right information out to the community. Keeping informed and passing that information along to friends and neighbors and people we work with and interact with is very important. And to add to what Nancy was saying is the importance of those informal networks. Many of us rely on informal networks, and it's important that correct and factual information is provided to keep our community informed and educated. This is especially important for those who may lack the know-how to navigate to find that information.
It's such a great point. And to follow up on it, I mean, one of the core principles of having the Complete Vaccine Committee, and I would say our vaccination effort in general, is that no Arlingtonian should be left behind because they speak a different language or don't have access to a computer or high-speed internet or any other reason. And that is especially true for those Arlingtonians who are part of communities that have been hit hardest by the virus, or by, so as you were describing, the layoffs or lost economic opportunities associated with it. And your organization, BU-GATA, and Nancy, the Arlington Free Clinics, have been essential parts of catching our neighbors for whom the online pre-registration system may not be working, who could otherwise fall through the cracks. I'd love to take a minute to just hear a little more in your capacity as leaders of BU-GATA and the Free Clinic, to hear more about what your two institutions are doing to help catch our neighbors.
So I could start with a few things. Arlington Free Clinic for the past 4 weeks has been providing vaccinations on site, both to our patients and then also to low-income residents in the community who have various barriers to access. And so we are really pleased to be a partner in that effort. And we're able to have callers reach out directly to these individuals to determine what their barriers might be. If they're hesitant about the vaccine and would like to talk with one of our medical staff or one of our nurses or someone who's from their community to help them be more comfortable, or if they simply need transportation, whatever those barriers are, we're able to provide those. We're also able to offer clinics on the weekends and sometimes in the evenings to work around their work schedule. So many of them have missed so much work during this time, and now that they're back to work, we hate to have them have to miss in order to come in, even for something as important as a vaccine. So we're really pleased with that. And then also one of our community partners in the Health Safety Net Neighborhood Health has also opened up a similar clinic on site at Macedonia Baptist Church that also takes away many of the barriers that individuals have. Transportation, they're able to provide service for people who don't have mobilities out to get vaccinations, even in their cars from time to time if necessary. And so we're really looking at what those barriers are and what solutions do we have to provide to make sure that, as you say, nobody is left behind.
Yeah. And Macedonia Baptist, as a quick explainer, is one of Arlington's amazing networks of historically Black churches. And they've been not only gracious hosts of that neighborhood health vaccination clinic, but a referrer of perhaps the older members of their congregation who may not otherwise have access, as well as working with the other network of Black churches in our communities. So but BU-GATA's played an important role also as a referrer. Would you want to say more about that work?
Sure. And as I mentioned earlier, BU-GATA, we focus on doing tenant outreach and education through our work. We interact with a lot of the community. Arlington County, 60% of the population are renters. And we've been around in the community for quite a while, since 1992, so we are known throughout the community. And like I said, our focus is it's tenant outreach and education, and through that, we connect residents to resources in that community. And as Nancy mentioned, the partnership with Neighborhood Health, we are an organization that can actually make referrals as well. So anyone looking to get a vaccine and is interested in getting the vaccine, we can also register for them to receive their vaccine through Neighborhood Health at the Macedonia Clinic.
Excellent. Thank you. A great example of a trusted partner, right? You've been building that trust for almost 30 years in the community. And so when you knock on doors and let people know that you're here to help, it means something. Well, Laura, you are part of an important group that isn't eligible yet, or in some cases, the vaccine hasn't quite been approved for yet, but is ultimately going to be a really critical group in helping us reach herd immunity in Arlington and the region. And that is, of course, young adults and students. So what do you hear from young Arlingtonians about the vaccine? And what do you think everyone should know about reaching our community of young Arlingtonians?
I think a lot of young people have not because the vaccine is now for older people, they haven't considered if they want to take the vaccine or what the vaccine is about, or how they haven't really formed an opinion about it. And I think one of the biggest things that we can do is maybe push for social media outreaches so we can get more information about how the vaccine works and how it's safe and things like that to younger kids. So when it's available for them, they can take it. And I think a lot of the bigger part of it too is for younger kids, their parents, they tend to do whatever their parents are doing. So if their parents are really convinced of taking the vaccine, then they will more likely take it. So I think also just emphasizing outreach to people who don't speak English or minorities, so that way that their kids can also take it.
That's a great point. Well, I'm thinking about one of the other important roles of the Complete Vaccination Committee is to help surface and elevate what you're hearing in the community, right? And we can kind of compare notes on that. By some measures, we're hearing as many as 90% of Arlingtonians are confident about taking the vaccine or plan to get the vaccine when it's available to them. Certainly what we've seen with long waiting lists, that's definitely true. But I'm interested, one of the reasons we convened as the CVC was that we wanted to reach people who might be a little skeptical or a little nervous. One example or one kind of nuance I've heard about from folks a lot is, especially in those early groups, maybe 1A, those who worked in long-term care facilities or things like that, was sort of the sense of, it's not that I'm skeptical about the vaccine necessarily, it's that I don't want to go first. I want to see how this plays out among others. So when you encounter those in your community who aren't registering, what do you hear from them? What do you think are some of the reasons people maybe haven't signed up? The barriers that we talked about, skepticism, or just a sort of not now attitude. What do you all think?
So we're seeing a lot of what you just said, of initial skepticism and hesitancy, and then now we're finding those people are calling us and saying, I'm ready to get a vaccine, even 3 or 4 weeks later. That I think time is going to help a lot of that. I think that a lot of young women who are of childbearing years have questions, and so we're suggesting that they talk with their physicians or their nurse practitioners or their trusted health professionals so that they can have some comfort. Women who are pregnant or breastfeeding really need to reach out there, because that's where a lot of our questions are coming from. And so we really want them to talk to their health professionals so that they're getting advice that's personal to them. So I think that that a lot of it is that as the immigrant community or as some of our populations start to get vaccinated, they are going to be our best ambassadors into their neighborhoods and into their communities. That's much more so, much more influential than I would be if I were trying to convince them to get a vaccine. And so we're really hoping to count on our patient population and on our immigrant community to help spread the word and to increase that confidence that that needs to happen in order for people to say yes.
I see you nodding, Saul. Does that resonate with your?
Yes, that definitely does resonate. What Nancy said is it's what I would add on to is that there's the issue of trust and misinformation, and so it's just getting that correct information out there. People sharing stories, and like I mentioned earlier, is I'm confident that getting as much factual information out there through the work of the Complete Vaccine Committee and our partners and our community leaders, that will help provide that factual information. It's about directing people to evidence-based factual information. That is what is most important. As Nancy mentioned, I also do the same. I encourage people to speak with their doctor or their health professional for any health concerns they may have, in addition to directing people to visit the county's COVID website, which has a lot of information and resources, or if they can't access the internet or anything that's web-based, that they can also call the information hotline that the county has provided, and reach out to, as I mentioned earlier, trusted organizations that they've been working with in the community, such as when they go for if they're receiving services from, like, say, AFAC, for food assistance, or through the Arlington Free Clinic. So yeah.
And that hotline is 703-228-7999 for anyone who may be hearing this and thinking, I would like to talk to somebody about the questions I have.
So one thing we're seeing, Katie, is that there's so much variation from county to county, from state to state, what Maryland's doing, what DC's doing, what Alexandria's doing, that the Complete Vaccine Committee has had a really important role this year in providing up-to-date, accurate information, because it's different from what it is across the state lines or the county lines. It also changes so quickly. 1 week things are at Walter Reed, the next week they're at Lever Run, the next week we're going to be in maybe in 1C soon. And as those things change, it's like, okay, here's another way to get signed up. And now CVS there's so much information, and it changes so quickly, and almost every hour it seems. And so to have one source in the county that's providing up-to-date, almost daily emails and accurate information to give people at least one place to go at the county that is up to date.
That's such a good point, because I think one of the things we learned as well in the early days of the Complete Vaccination Committee, when we were experiencing global shortages, in some ways we're still constrained, and there were rumors abounding about how to access it or individuals jumping the line. I think we learned that when people hear misinformation or confusing messages about the rollout, that actually can kind of feed into general mistrust about the vaccine. So I think that's such an important point, is trying our best to communicate clearly as members of the CVC about which sources of information, not only about what's in the vaccine and is it safe, but frankly, how can I access it and when, and is it being distributed fairly? That's really important too. Laura, I don't know if you want to get in here, and you give us some great insight about students and young people. You wear a lot of hats in this community, right? You play a leadership role as a young person, but you're also a member of Arlington's Muslim American community. I don't know if you have other perspectives from the groups of which you're part about what you're hearing from people when it comes to access to the vaccine or their thoughts about getting the vaccine.
I've heard a lot of minorities who are kind of skeptical about that vaccine, and similar to what Saul said, I do think there is like a mistrust in the government, and I have also heard a lot of older people say that they don't want to take the vaccine because they fear like the side effects, and And I also did really like Nancy's point of like maybe making an email or kind of like what I said earlier, maybe like social media, because I know people are at home and they're spending more times at their phone and they might not have time to like, go search up a website or, check things like their email regularly. But I think social media might be like an easy way to get people's attention and to kind of debunk misinformation.
I love that point. Actually, our superintendent was just talking with the chair of the board, Matt, and me the other day about how some parents have flagged the need for Spanish language TikToks because young people, and even in some cases their parents, are getting, unfortunately, misinformation via that source. And so what can we be doing? So one of the things we've been kicking around is the idea of filming very short blurbs about why people are getting the vaccine. So maybe we can wrap up actually with that question. Whether you've gotten it already or plan to when you're eligible, what's your why for getting the shot?
My why is easy. I think there has been so much sorrow and so much heartbreak in the community that we serve at Arlington Free Clinic, and it's just so important that there's finally some hope to offer. And there's a light at the end of that tunnel, as we keep hearing, but it's just finally to have some hope to latch on to.
I love that. Laura, what about you? When it's approved for your age group and it's your turn in line, why will you be getting a vaccine?
I would get it because I think that COVID has taken away so many people's lives, and I don't want it to take away more people's lives. And I think that just getting a vaccine would really help kind of solve the issue. And I think that it's something simple that I could do. So that's why I would take the vaccine.
So what about you? What's your why?
Definitely couldn't agree more with Lara. It's for our health. It's to stay safe and to get back to our friends, back to our family, to once again be able to gather, to shake hands, to hug our loved ones. It's for our future, so we can get to once again enjoy being out and breathing some fresh air, and just having that enjoyment of going out and feeling free that you can breathe again. However, it is that hope that we see, but it is also important that we continue to practice safety, to keep social distancing, wear our masks, and wash our hands until we stop the spread of COVID in our community. So I think that's very important, and that's my why.
I love that. And I'm with you, in addition to all of the really compelling reasons you all talked about ending a pandemic that has been so hard on our community, however you define community, Arlington, our neighborhoods, or even our global community. And I also, for me, a big part of my why is the idea of being back at Buckingham Day or the Priobangla Street Festival, right? Arlington is at our best when we're together and exchanging our cultures and being with one another and learning from one another. I really have missed that over the last year. And I think about the opportunity to get this vaccine as a step that gets me and everyone else closer to being part of this amazing community in person. Well, on that note, I can't thank you all enough for joining us, and thank you to those of you who've been tuning in tonight. Saul gave the pitch as well as I could. Even if you've been fully vaccinated, please keep being safe, keep wearing a mask, stay 6 feet apart from others, wash your hands, and practice all of those important physical distancing and social distancing steps so that we can beat back this pandemic together. Stay safe out there. Thank you again to our guests, Saul, Laura, and Nancy, and for your leadership on the Complete Vaccination Committee. Have a great night.